Welcome back. If you need to get your back pain, neck pain, headaches, auto accident injuries, anything treated at one location, North Florida Medical Center and the Back and Neck Institute say they're here to help. Please welcome to the show Dr. Adam Bordas and Melanie Jordan. Appreciate you guys joining us.
Thanks for having us.
Let's talk about your background and what you guys do over there first.
Well, yeah, my background's actually in fitness and dietetics. I was the guy going into major Fortune 500 companies talking about, healthy living and weight loss and stress relief. Not like any company needs that at all, right? And after a while, I came to realize that if people were in pain all the time, right? I mean, if your back hurts or you're having headaches every day, you really can't do the things you need to do to live healthy. So that was the day that I decided to go into chiropractic.
And how about you?
Well, I qualified as a physical therapist about 20 years ago, and I've worked both in Europe and in the US, and treating people from tiny babies through to seniors. And I think my passion is really function, finding out what it is that people want to get back to, and working with them to try and achieve that. So whether that's helping a premature baby learn to sit by itself, or somebody with chronic back pain maybe getting back into their golf game, or I don't know, dancing at their daughter's wedding, or even somebody with sore knees who just wants to get back and do that walk around the block in the evening.
Yeah, that's really a more practical approach, which is better. And talk a little bit about the difference between you guys at North Florida Medical Center and other places around town.
Well, I think a big part of the difference is, a lot of offices just have maybe one or two practitioners at most, maybe just a chiropractor, maybe just a medical doctor, maybe just a physical therapist, but we actually have 7. We have a family physician, we've got pain management, myself as a chiropractor, we've got Melanie as a physical therapist, we've got a nurse practitioner, we've got a physician's assistant, we've got a massage therapist. Who else do we have? Is that pretty much
you've covered it, yeah.
We've got a zookeeper. I don't know. We've got everyone in the same location. So, it's a collaborative approach. We try to keep everyone in one location. It creates a one-stop shop for our patients.
Well, that's got to be an added benefit, because when you're going to get treatment for something, to not have to leave that building and go across town to another place, do you find that patients see that much more beneficial to them?
I think so, and I also think, well, it helps us as well as the patients. I mean, historically, if we wanted to discuss a patient or get a second opinion about that patient, we would have to refer them to another office, hope they got back to us, and the whole process might take weeks if we're lucky. We find that in our office that can take 5 minutes. We get up, we walk down the hall, we knock on the right door, we have the discussion, and we're good. And I think we really feel that offers a truly collaborative approach to each individual patient, and we really see it as the way forward.
And it's not lip service. I mean, we do this every single day, and we have conversations every single day about our patients.
Do most offices, I'm thinking they don't, but do most offices have an MD and physical therapist together in the same?
It's very rare, yeah. And we don't know why, frankly, because whether it's ego, whether it's fear, not understanding what the others do. On the way in, we were talking about this morning. Why is it? Why do offices not really, or why do offices not have different specialties under one clinic or under one roof? And it really comes down to lack of understanding. The medical community not believing in chiropractic, and chiropractors not believing in medicine. It's about patients. It's not about what I do versus what you do as another practitioner. It's about our patients, and again, it's all about collaboration.
And I also think that working so closely together, we get to get more experienced about how each of us can differently help the patient, and I think that's great for understanding and a team approach.
Yeah, no, it seems to make sense, which is kind of why it's weird. To ask the question, like, why don't most offices do this? But I really like that it seems that patient-centered approach is definitely what you guys are doing, but more and more in the medical field, we're seeing that.
Yep.
Let's talk about where your offices are for people out there who might have some back and neck pain and stuff. Where are you guys located?
Well, we have 2 offices. One is in Orange Park on Highway 17, and the other new office is in Jacksonville, where I-95, just off Bay Meadows. And
for anybody out there, like we've talked about my lower back issues, like I said, knock on wood, everything's good right now. That's why I retired. And stopped eating Advil. But for those out there who might be dealing with some back, neck pain and looking to get some treatment, what do you have to say to them?
Gosh, well, bottom line, your health matters. Your health is a big deal. It's all we've got. We've got one body, and this is it. So we always encourage people, whether you have an ache, a pain, a lump, or anything going on with your body that isn't normal for you, get it checked out. We've got a great team in our facility, and we'd be happy to help in any way we can.
Appreciate you guys joining us.
Thank you for having us.
And we'd like to thank North Florida Medical Center and Back and Neck Institute for making this segment possible. And to schedule a free consultation, you can just call 904-518-6511. And for more information, visit nfmcjax.com and endyourpain.org.